is about thermal injuries, the types and degrees of thermal injuries. Firstly, definition of thermal injuries. Thermal injuries, these are burns due to external heat source that raise temperature of the skin and tissues, thereby leading to the death of tissues and charring. Types of thermal injury according to depth. We have the full thickness burn. In the full thickness burn, this burn destroys the dermis and the epidermis. It also damages the underlying bones, muscles, and tendons. The burn site appears white or charred. There is no sensation in this area because the nerve endings have been destroyed. Next is the partial thickness burn. Partial thickness burn is divided into superficial partial thickness burn and deep partial thickness burn. In superficial partial thickness burn, it extends superficially into second layer of the skin. The symptoms include red skin that turns white when pressure is applied. For example, when you apply your finger onto the red skin, this area can turn white. Clear blisters which are present and they can be open or closed. The skin is moist and painful. Next type of partial thickness is the deep partial thickness wound. This type extends deeply into second layer of the skin and can evolve quickly into a full thickness burn. Symptoms include the red and white skin that does not blanch readily, blood blisters. The skin is moist and painful also. Next is classification of thermal injuries according to degree of burns. We have 4 degrees of burns. First degree, which is also known as superficial burn, affects only the outer layer of the skin, that is the epidermis. The burn site is red, painful, dry, and there is absence of blisters. An example of first degree burn is the sunburn. Long-term tissue damage is very rare and just consists of an increase or decrease in the skin color. Second degree burn, which is also known as a partial thickness burn, involves the epidermis and part of the lower layer of the skin, which is the dermis. The burn site is red, blistered, and can also be swollen and painful. Next is the third degree burn, which is the full thickness burn. In third degree burn, there is destruction of the epidermis and the dermis. It could also go into the innermost layer of the skin, which is the subcutaneous tissue. The burn site could look white or black and charred. Last is the fourth degree burn. This is the deepest and most severe of burns. They are life threatening because these burns destroy all layers of the skin as well as the bones, muscles, and tendons.